Good evening. Yes, we're back. I'm Dr. Mike Sevilla, President of the Ohio Academy of Family Physicians, and we are back. It is Sunday night again. This is Bite-Sized Learning. We have a great talk, a great conversation that is coming up. First, just a couple of things for our great OAFP members. If you haven't gotten to take advantage of it, just the first announcement is the Ohio Department of Health's Breast and Cervical Cancer Patient Navigation Program. The Ohio OAFP is offering continuing education webinars free of charge for those who are interested. So we had our first this past week, and we have a couple more coming up. You can go to ohioafp.org to check out that information. Also want to let everybody know the ABFM is having webinars for residents and new to practice physicians. The next one's coming up on June 15th, ABM Family Medicine Certification, a Q&A for residents. You can get more information and register at ohioafp.org. And of course, I have to mention the merch. That's right, it's still here. It's good stuff. You can go to the website, you can get shirts, you can get masks, you can get all that kind of stuff. You can get, I'm an OAFP vaccinated family physician. All the proceeds go to our fabulous foundation, which goes towards programming for family medicine students and other cool stuff. So I apologize for starting a little bit late tonight. We had some technical difficulties. As you know, we're at the cutting edge of technology here. And sometimes the technology just does not cooperate. So we appreciate your patience. And if you miss any of this program, you can catch it on demand, or you can watch it later. So let's get to the introduction of our topic tonight. Utilizing StoryCorps as a narrative medicine approach to understand the effects of COVID-19 amongst seniors in a Cleveland neighborhood. And I just want to introduce our panelists here. Varun Gopinath, MPH, medical student at NEOMED, and participant in the AAFP Foundation Family Medicine Leads Emerging Leader Institute, which we'll be talking about during this program. And one of his mentors, Dr. Linda Stone, is also here. And I also want to give a big shout out to Dr. Sanjay Boyd, who was also a mentor, and we will be talking about that as well. So welcome, panelists. Good evening.
Good evening.
All right. So Varun, you're gonna be sharing your slides here a little bit, but just want to give a big shout out to Dr. Stone, because we love Dr. Stone. But for the one person who's watching this who doesn't know you, just introduce yourself and just say just a little bit about your project. Of course, it's going to come out during the slides, but introduce yourself to our audience, Dr. Stone.
Hi, I'm Linda Stone. I'm one of the past presidents of the Ohio Academy of Family Physicians and work as special assistant to the Dean for Humanism and Professionalism at Ohio State. And I met Varun through the Emerging Leaders Institute, and those of you who do this, don't you meet the greatest people? So, Varun?
Take it away, my friend.
All right. Hi there. My name is Varun. So I'm a third-year medical student at NEOMED in Reestown. So I chose to my project focuses on the Fairfax neighborhood, and Fairfax is located in a unique area in Cleveland known as the Forgotten Triangle. It's an East Side neighborhood that has some significant health disparities. You've probably heard of infant mortality rates being low, as well as lead. And there's just a lot of factors that I learned about during my medical education and through my mentor, Dr. Boyd, that I kind of wanted to focus this ELI project on. And this project uses StoryCorps, which is a really cool, unique kind of way to tap into kind of the hearts and souls of what our patients are going through. And so trying to understand the disparities that are going on within this neighborhood right here in Ohio. And so just to give you some context of what this project really focuses on, it's trying to show that health and the health that we kind of help keep up and the well-being of our patients is housed within these social determinants of health. And it's housed within the community at large and what's going on with the community. So we can't look at heart disease or COPD without looking at these kind of larger mechanisms that are at work. And so this project hopes to bring the clinicians closer to the patient populations that we serve. And so objectives for our project is to kind of gain appreciation for geolocation, health disparities, as well as structural racism on health and well-being. We're hopefully gonna hit on some topics on loneliness and how it's been exacerbated during the COVID-19 pandemic on seniors. And what is StoryCorps? What is StoryCorps Connect, which was uniquely created during the pandemic to practice kind of social distancing while being face-to-face on kind of these social media platforms. And kind of also like, how can we use meaningful conversation? So that part where we're actually talking one-on-one with our patients to facilitate reimagining. How do we solve these problems? How do we address them? And trying to create a sustainable model of this project that could possibly be utilized in schools, embedded within curriculums, and help for training for further medical education.
Now, Varun, if you don't mind me just jumping in,
Yeah.
I mean,
Yeah.
you have a master's of public health right now, which is like incredible as a medical student. How did that background kind of be the framework for some of these ideas to start this project or think about this project? Because there's a lot of public health in these first couple of slides, and I see that kind of as your background as far as really kind of thinking about this as the origins of this project.
Yeah. I think a lot of it for me is, I mean, this map kind of, for me, public health, so it was kind of this unique area to see health as more than just the medicine that I think is currently being practiced. And I think that background did definitely seep into this project, whether it's using location, whether it's using the social determinants of health. So that background definitely influenced this specific project. Yeah, are there any other specific questions you have on?
No, it's just
Okay.
I see the very influence in the first couple of slides here, and I think that's a great background. I think that the viewers need to know that you have this whole experience with public health coming into this, and I think that was just as an outsider, kind of is very influential to that. And feel free, Dr. Stone, just to kind of chime in as we go through this. This is supposed to be a conversation and not really a one-way kind of presentation. So Varun, I'm sorry, you can continue.
Yeah. So, I mean, talking about public health, you always, when you're developing these projects, even before my degree in public health, I've done a needs assessment on indigenous populations in Ecuador. And so that's kind of the groundwork. That's kind of the work, whether it's community organizing or whatnot, you kind of have to understand what is the community going through. So first you need to identify who are the stakeholders. So this project, I had this big kind of idea of focusing on addressing health disparities in inner city Cleveland. But then I had to, with the help of Dr. Boyd and Dr. Stone, okay, but who are the partners we want to partner with to get this going? And with Dr. Boyd's affiliation with UH at the Otis Moss Jr. Health Center, that was a key partner. The participants are a stakeholder and a partner, going through IRB and credentialing, as well as my Department of Family and Community Medicine, and reaching out to StoryCorps to see, has this been done before? How can you all help us out with this? And so that's the first step, is you need to kind of do this sort of work to then build a project from the ground up, rather than us saying, oh, the data points to this being the problem, we think this is the best solution. So I think that kind of is what that public health background kind of will seep into my future practice as well. So getting into that background, I think just to give some context, we've heard of the Great Migrations, the first and second Great Migrations of African Americans moving from the South into industrial centers like Cleveland, like Pittsburgh, like Detroit. And I think understanding that co-occurring as the interstate system is also being built. So white flight is also occurring into suburbs. And so a tax base within the inner city of where Blacks are moving in starts to dry up as people move out to get more land. And what does that do to infrastructure? What does that do to public schools, unemployment rates, and how does that affect the health of the communities that we now, that a lot of these academic medical centers, at least, do serve? And so just to give you an idea of where the Fairfax neighborhood is, this map kind of highlights that. The Otis Moss Junior Health Center, which this project is housed out of, is at the heart of this neighborhood. And just looking at this map, you're seeing these big buzzword kind of names, brand names, really, right? You see Case Western, you see Cleveland Clinic, and then you're like, okay, what is this place? There's a cemetery. Jesse Owens actually went to East Tech High School. That's something that I find very unique. And I think that this is, and he is part of that kind of those great migrations. He originally is from the South. And so trying to get an idea of what is the history. And that's a little bit more about my background is I have a degree in history as well, which understanding the story of a place draws you in to the communities you serve. And just to get an idea of Fairfax and the Otis Moss Junior Health Center, which Dr. Boyd is the medical director at, it was created in 1997, but it's really there to address disparities that had been going on from this kind of like, from what I had already been talking about. It's something you all probably have seen within the clinics you serve or wherever you're at. And that this is the story of Fairfax. And so what this project kind of tries to look at is, okay, what's their story? And then let me try to understand how to develop a project out of that. Another thing that was also occurring at this time was loneliness in seniors. And Dr. Boyd was seeing this on the ground. She was talking to me and how her patients were. And it's something that also Dr. Stone had highlighted. Loneliness is something that is important, and it does affect health. I mean, just the fact that loneliness can be as dangerous as smoking 15 cigarettes a day, that's wild. It can increase rates of risk for dementia. So these are real things that clinically affect our patients. So this was happening during the pandemic, okay? And racial or health disparities was also going on during the pandemic. And so as we kind of gather this idea of what's going on while I'm developing this project, we choose none other than StoryCorps as how we're going to address the problem. And that's what the ELI, the Emerging Leader Institute, is really about, is kind of reaching for the stars, doing a project that you don't think you can do, and trying to do it and see what happens. And so I contacted StoryCorps, and they gave me full support just so long as I first received IRB approval, which that it was very difficult, but they did say this was a very unique project that they would love to be a part of once the approvals were in place. And so all these stories, basically the StoryCorps body of stories, are housed within the Library of Congress. So it's an oral tradition. You can listen to these stories online. You can listen to them on the radio. And the importance is placed on listening to those that are often silenced or ignored. And I think that's a key point.
Mike,
So just to give you yeah, go ahead.
I'm just going to point out that I know Varun is saying the IRB and all the things he ran into. This was one determined guy to get this project through. And it was a beautiful melding of his public health background, like you said. And if he hadn't determined he was going to be a family doctor after this project, I think we all would have gone after him, because thank goodness he's going to be a family doctor, because he married this whole idea of public health and service with what we do as family docs. We listen, we hear the stories. The stories help guide us on how we treat our patients. And Varun was just a real natural at that. I just wanted to point that out.
Oh yeah, and I didn't really understand the story. I know the next slide is going to be kind of explaining it to the audience here. So, so why don't we do that, and then we can pick up, because I have a lot of questions about this StoryCorps and
Sure.
You know, the idea with it.
Okay, so let's see if we can. Here we go.
This is Dave Isay, founder of StoryCorps. To record your StoryCorps Connect interview, log into your StoryCorps account and follow these simple steps. Step 1, pick someone to honor with an interview and invite them to participate. Step 2, prepare questions using our great question list. Step 3, go to StoryCorpsConnect.org, click Record Your Story, and send the interview link to your partner. Step 4, click Start Recording Audio, ask your questions, then listen closely. Remember, you can't pause an interview. Step 5, when you're done interviewing, click Stop Recording. Discuss the privacy setting that feels right with your partner, then save your interview. Step 6, add a title and keywords to your interview. Step 7, archive your interview. Rest assured, the audio and still photos from your interview have been saved. After they're processed, your interview will be preserved in the StoryCorps archive and at the Library of Congress, where it will become part of American history. Share your interview far and wide, and know that someday, future generations will be listening.
So Varun, how did you first hear about this StoryCorps project in general? Is it from your history background, or how would you be made first aware of it?
Yeah, StoryCorps, I think I listen to the radio when I'm driving to school, or like NPR in the morning, and I think StoryCorps was one of those unique kind of programs that were featured on NPR, or there's also something called The Moth. And I think that kind of oral tradition was something that I've always found, I don't know, I'm drawn to it. And I think and I think that's how I got into this idea of, why don't we use this as a tool? How do we use, and it's also, I'm going through my clinical year right now. So I'm seeing patients, I'm being evaluated. And I think that's the thing, is trying to be rooted in who I am intrinsically, while you're also being asked to be more efficient, to get down to the assessment and plan, and sometimes spending the few extra minutes with the patients I helped out with made it more meaningful. I felt less burnt out. I actually liked helping out with patients. I was there for extra time. I would come in early to talk to my patients, and I think it also helped. And so I think that kind of is how I found StoryCorps, and how do I incorporate this into a project within medical school.
Wow. Wow. Now, there's going to be a lot of medical students who are going to be watching this, and they're going to be saying IRB and, the difficulties. Can you, share a little bit with the audience, especially medical students, some of the challenges with the IRB, because this is such an outside the box type of thing, and maybe share some of the challenges that you had, because I know that, a lot of medical students, especially family medicine medical students, are going to be like, hey, I have some ideas, but we have to get through this process. Can you share a little bit about your process, especially dealing with the IRB?
Yeah, let me get to.
Or am I jumping ahead? I'm sorry.
Yeah, I mean, you're jumping ahead, but I think we can go I think to answer that, the process of the IRB, I think, is first understanding. I think the bottom left kind of flow chart kind of shows you how you kind of go through this process. But you first need to understand who has kind of jurisdiction of the project that you're undertaking, right? Or is this, or basically the patients or whoever the participants that are going to be within your project, are they within your school's IRB? Are they housed within a different health system that is affiliated with your school? And I think there's always there's an IRB institution at your school that you can always email or reach out to first, what are the first steps? And I think that's what I did. I had kind of some exposure to IRBs in the past, but it was always a strenuous one. And I think that's one thing to learn is IRBs are going to be strenuous. It's going to be something hard, but you kind of have to push through. And when they give you feedback, how do you respond? I think that is another thing about IRBs is the IRBs weren't created to stop you from doing really good work. They were created to protect patients. They come out of patient protection, whether it's the Tuskegee syphilis study or what was done by the Nazis in Germany. And so I think we need to have an understanding that the IRB is not there to stop you from helping your patients. It is there to protect people. But it is a necessary step to go through before you can do any of these kind of projects as well.
Wow. Dr. Stone, did you have any advice for medical students as they're starting or as they deal with IRBs or research or any kind of regulatory thing in their system or in their hospital? You're on mute.
I think Varun hit the highlights of it. You look in your medical school and just ask, who does the IRB? How can I touch base with somebody? And the other thing is a lot of family docs do research, are familiar with the IRB process, find those that can help you. Now, Dr. Boyd was great in that I don't think she had much experience with it, but boy, she went to bat to find out about it. And so you just find your champions, if you will, and when you're doing something like storytelling, I think it hits the heart of family medicine. So people will try and help you along the way. Just ask.
Great. Cool. Well, I know, Varun, I've completely gotten you out of order. So I know at some point you have a small part of an interview that you were going to share with us.
Yeah. Just to give you a little bit of background to the questions that we were looking to do in this pilot project that's still within the IRB scope, we're trying to focus on the COVID-19 pandemic. And so these are some of the questions that open-ended questions. It's the open-ended questions that we get taught during patient interviews. But it's more so, how has living through this experience made you feel? Are you afraid? What frightens you? What's the most challenging part? But there's also other questions that just come up randomly. And I think that's the coolest thing is when I did a mock interview with actually Dr. Boyd's father, who is part of this great migration. He moves from Tennessee to South Bend, Indiana. And because I had his approval and he wasn't a patient, we didn't have to go through IRB so that we could just practice. and see how did this go, how was the flow, and his story is very unique, and I think everyone's story is very unique. But I did want to share kind of a 3-minute audio clip that I think the audience would try to get a glimpse of what these kind of interviews look like.
That was way back in, I was in like in the, I was, 20-ish in that area.
Okay.
Because, we've been married for, goodness, a long time. But she was the she was the finest woman I believe I've ever seen. She came into church, and when she came into church, I said, good googly woogly, who is that?
Mm-hmm.
And so we finally, I kept messing with her, and there was other girls that liked me, because I was like the basketball star and all that kind of stuff. But I had my eyes on her, and so it wasn't long that, we got together and we got married. And we've had, most all of our kids, since I wanted to be a doctor kind of thing,
Mm-hmm.
I wanted to get into that, and that's why a lot of the kids in our family are in the medical field.
Wow. So where was this church located? When did you?
It was in South Bend, Indiana. It was on Hamilton Street, and we went to an old place on we call it the West Side, and the minister there, he was saying, we gotta get out of this area. There's a nice place over on the west side of town, a nice place, and they wanted to build a church. And he told everybody about tithing, give 10% of your income, and if you do it, you'll never regret it. And that is the truth, because I started being a giver, and we just, the church, we moved from Catalpa Street area from the old church to a brand new big church. Matter of fact, I think, did they build, I don't know whether they actually built it or whether it was just we had the opportunity to buy it. I don't remember all that, but we ended up being over there, and then that's where I met my fiance, right there at the church.
Wow. And did she move into town? Was she new, or?
Yeah, they used to live in Michigan,
Mm-hmm.
and they ended up Cassopolis, Michigan, and they ended up in South Bend, where we call the place, they call it the Lake. And they lived there, and I met her, in the church. And then after I met her, I kept messing with her, and she told me, she said, I'm going to go out with you because you're going to have to stop bugging me. So we went out together, we went to some of the, the little, the old shows that used to have outside, where you pull up and, that kind of thing.
Mm-hmm.
And, but I knew when
So yeah, I think that kind of is just a clip of what these kind of projects can do. I mean, yes, we are physicians first and foremost, but I think we need to also, this is that healing part. This is part of being that healer, is listening and truly listening. But you also start to get a glimpse of, I've never been to South Bend, Indiana. And he's naming off streets. So actually after the interview, I'm like looking up like South Bend, and where was this? What side of the street was he on? And I think that's the coolest thing, is you start to get this spatial awareness and more of an appreciation. And then with StoryCorps, you can actually tag. And so I've tagged South Bend, Indiana on this. I've tagged the Great Migration on this. So when people are looking for oral stories in the future, they will start to build an idea. And I think that's kind of what this project is about. It's not necessarily like getting to a goalpost or a point where we get this profound theory or whatnot, but I think the idea is to just listen.
Yeah, Varun, I'm fascinated by process. I mean, but was there like, 50 questions that you whittled down to these little ones, or these few lists, or what? How did you come up with a question list?
Yeah, the questions were ones that actually StoryCorps had actually already picked for the pandemic,
Okay.
for
Gotcha.
people that were going through the pandemic.
Gotcha.
And that's how we got to those questions. Though at the same time, when I was kind of pushed during this mock interview and when I did with my father-in-law, I realized the point isn't to stick to those questions. Sometimes you naturally flow, and it's really a one-on-one relationship. It's very natural, and it's the way you go about when you're talking to your own patients. When someone comes to you, what is patient rapport? And I think that's where I found a unique kind of way as a, if you want to call it a researcher, but as a student, a clinician, and as a future family doc, is something really special.
What's your next slide there?
All right, so the next slide is we did the questions. So I guess like some key learning points. We've kind of hit through a lot of these. Key learning points is that we've already talked about understand which institution has whatever your project is defined as, who kind of has purview over that. And then from there, you need to reach out to just Google IRB at that institution. So I actually ended up going to 2 different institutions, both of them saying that they had purview. And I think that's the hard part, is figuring that out. I also ended up having to get credentialed at UH, which at that time we did not have an affiliation agreement with NEOMED, which was kind of difficult. I mean, that's where my Department of Family Medicine kind of came as kind of a Swiss Army knife, and they were like, we will support you. So whether it was paying the $150 credentialing fee, or just being like, yes, we fully support you on this project, and keep on going. And I think that's what I needed as a student, and just being flexible with yourself. And it's okay, like, oh, the project is not moving as fast as I wanted. We're also going through a pandemic, and I think communication was really key. Trying to figure out emails, follow-ups, how do I reach out to people when I can't see them or go into their office? And then you just got to trust the process that you're going to learn something from this project. And so something Dr. Stone really kind of hit on was that this was the project, right? So the ELI project isn't necessarily just did you do what you set out to do? It's also, how did you as a leader, as an individual, change over time? And what sort of skills or what did you learn from it? And trying to have that growth mindset was also part of how I'm going to take. Those are some key takeaways that I kind of look forward to using in the future not everything is about the goal. The journey is the goal, right? And trying to look at that. And so I guess like the future of this project is to complete the pilot study, which is 10 individuals. We are currently still in the process, correcting whether it's wording or and whatnot, but we will complete it, the pilot study, but then expanding upon it during my senior capstone, which should be a lot of fun, as well as incorporating this within our urban pathway here at NEOMED as part of the senior capstone projects that other 4th-year med students after me can take upon doing it. And not only does it help with physician training, but I also think it allows individuals to better understand, feel like they're being listened to rather than being a lab rat on who we do different treatment plans on. And I think that that's what we're trying to achieve, is we're trying to achieve bringing the clinicians, us as physicians, with the patient populations we serve. And I think that's how we're going to get better, high quality healthcare. Sometimes that's what it takes. It's as simple as listening to each other. And I think that's kind of what this project encapsulates.
Mike, I think one thing that a lot of people in the OAFP who teach with the ELI find is you have these great conversations going along, because you meet at least monthly with your mentee. And so there's so many discussions we had on servant leadership, on relationship-centered care, on narrative medicine, on so many different topics that we love as family docs. So if you're not doing ELI, I'm going to put a plug in to do that. But Varun has been fantastic all the way through this and wanting to have these deeper discussions about what he was doing.
Yeah, when we had kind of our little, pre-meeting meeting, I mean, one of the things, Varun, that you said is that, one of your many passions is health disparities. Mm-hmm. And that's one of the many things that were driving you for this project here. And something interesting that you said, which I'm not going to say eloquently, but I will let you do that, is that, this StoryCorps thing, is for this particular one around COVID-19. But as you're having these conversations, as you're anticipating future conversations, that COVID-19 is just a point in time, but the difficulties and the challenges with health disparities, some of them have already been there, but COVID-19 kind of amplified that. Can you expand upon that idea that you talked about the other day?
Yeah, I think that's like a very, that's a point that I've kind of realized is COVID-19 is an exacerbation of issues that were already going on. Whether it is the mental health state of the patients we serve on a day-to-day basis, whether it's the systemic issues that were occurring, COVID-19 basically stressed the system to a point where issues that were already there in the background kind of were stressed to the point where you could see them, you could visually see it. And I think an analogy that I'm just thinking right off the bat is American infrastructure, right? Roads, bridges. You put a bridge that is currently there that everyone's walking on. It looks great, but then someone deemed it as this is unfit for cars to drive on. But then everyone just keeps on going over, there's no restrictions, and then eventually it caves in because there are internal structures that are rusted and I think that's the thing, is that exacerbation was that extra weight where it kind of pushed things out into the open to see what's actually happening. Whatever was under the surface has now just percolated up. And I think that's an important takeaway from COVID-19. Yes, we can look at it as, oh, this is a terrible pandemic. And yes, it's caused a lot of death. But I think you do have the opportunity to look at it. Wait, we are now seeing problems with really great clarity that we can now kind of hone and address right now. And
one of the reasons why you picked this particular neighborhood in one of your early slides is that it's a very unique neighborhood. It's a neighborhood in one of Ohio's biggest cities that has its own challenges and its own particular, especially you see it here, the location it's in a big city. It's in close to huge hospital systems. But it's a place that has a lot of health disparities, and that's why this particular neighborhood was selected. Do I have that correct?
Yeah, so I'm part of that urban pathway, and so we learned a lot about redlining. We learned a lot about, and this is not just the story of Cleveland, Ohio. This is the story of every city that you can think of here in America and abroad. Usually these academic medical centers and wealth that are institutions are co-located in their own zip codes are struggling. And so I'm not putting the blame on any one person or institution. I'm just saying we need to observe this. We need to just show this. And I think a map kind of shows it as, why is that? And what's going on? You have some of the best healthcare systems in the world, and yet you have some of the worst health disparities in the nation. And I think that's something to bring up. And so how do we not only make connection, and I think that's what this project also seeks to do, is let's connect these institutions that are amazing to the communities that are right around them. Like, let's build the bridges instead of saying one person's wrong. And I think that's what the StoryCorps idea is also about, is bringing people together.
Yeah. Yeah. And Dr. Stone, you probably see this in the Columbus area too. I mean, there's probably neighborhoods in the area down there in the shadow of these huge medical institutions and, that have these health disparities, which is really hard to figure out and hard to know because, how can you have all these health disparities 2 blocks from a major health system? That's got to be very frustrating for everybody.
One thing that I've loved being at Ohio State is that they've had a number of initiatives to do exactly what Varun is calling us to do, is to go into areas that are underserved and bring the wealth of knowledge and the wealth into areas in which there's great need. Access to care is such a big thing with us family docs. And I think we need to hold all of our academic health centers, all of our medical schools accountable.
And I think, Varun, something you said also is, especially with your MPH background and just with your advocacy background, not only do you want to address the health disparities, but you want to see that converted into health policy to help address this kind of on a larger scale. Would that be right?
Yeah, I think health. So I'm on the policy track within ELI, and when I was thinking about it, I couldn't, at least where I'm at, go straight to policy. At least in my head, I first had to gain some understanding of what's going on the ground before developing that policy. But yes, the goal is to get there. How do we build policy? Whether it's, okay, let's have better parks, let's have fresh produce, safer neighborhoods, more job opportunities how do you hire more people from the Fairfax neighborhood to work at large medical institutions, right? This is wild to see, but if you look on Carnegie Ave, as you're coming into the Cleveland Clinic, which is #1 for cardiovascular health and that sort of stuff, you have a McDonald's, a Dunkin' Donuts, and a Popeyes that line the street. And I think that is and as I biked through Cleveland and I would see that, I was like, this is ridiculous. I would see people with their patient kind of their IDs and gowns going from the clinic to the McDonald's. And that's kind of disturbing. And so policy can be developed, but you have to do it with the community rather than us making the policy. I think there needs to be kind of these listening tours, town hall meetings, and working with government to develop the appropriate policies that they need.
Cool. I don't know if you had any further slides. I didn't want to skimp on your presentation here. So
yeah, my last slide is a thank you to Dr. Boyd and Dr. Stone. They have really walked with me on what has been an incredible journey in terms of, it's been hard. I'm not going to lie, being a 3rd-year medical student during the pandemic and doing this project and taking this on has been kind of lonely. You are trying to do this, you're I think that's the hard part, is trying to see the vision sometimes, and seeing the promise can be hard when you're alone. But when you have mentors that have already been there, and have been in your shoes, to kind of guide you and walk with you, I think has been very helpful. And it's just been incredible to kind of have that mentorship. And I think that's another thing medical students should really try to work on. You're exposed to tons of attendings, tons of residents when you go through your clinical years, is to develop those relationships, because they can help you in ways that you may never know. Right. Yeah.
And Dr. Stone, I know you've touched on it a little bit before, but maybe describe to those who are maybe interested in maybe being an ELI mentor at some point, what's that process like? And then maybe close your remarks. You've talked about it already, just working specifically with Varun on this project.
The AAFP really guides you through it. I mean, you get emails that tell you what you need to do, even the questions you need to ask on a meeting each month. Everything is outlined for you. You couldn't be guided through this better. And then you have hotlines to, you can call them. So don't be afraid to sign up, because as family docs, you have so much to offer to these students. And what I can say about Varun is it has been a privilege to work with him. And I look forward to seeing him make a huge difference. And he didn't mention he's also in the military. So he has so many things he's bringing to our beloved specialty.
And Varun, I know you talked about it before, but if there's a medical student interested in ELI and interested in this project, can you share a little about your process, how you applied for it, and that type of thing?
Yeah, so I found out about ELI. Actually, I went to the national conference. I think that's the first place to do. Go to the national conference. Like, there are scholarships available that OAFP provides, as well as the AAFP, and your department will send you. Your FMIG will send you. There is money out there to send you to the national conference. So once you get there, I think that's where I kind of discovered what ELI was. I saw the ELI scholars, they were taking their picture, and I was like, what? Who are those people? And I think that was kind of, I was like, okay, let's Google it. So you just Google ELI. And I think that's where I kind of was at, is this is interesting. This is really competitive. I don't know if I can do it. And I think that's the thing, is sometimes you just have to jump. ELI does not select based on your resume, your CV. It selects based on potential for leadership. And I think I thank the AAFP for selecting me. When I received that letter, I was kind of surprised. And I think the cohort I'm with is really unique. And I think it's a unique opportunity to build mentorship, and to not be afraid to apply. And I think that's the hard part as a medical student, is you have a voice. Sometimes there's this negative thoughts kind of go in your head, but you just have to try. And so what if you fail? It's okay. That's the learning process. But highly recommend it for anyone, anyone considering it. Yeah.
Cool. Great. So as we close up our conversation tonight, I'm going to ask each one of you maybe for some closing thoughts for our audience, as far as the things that we've talked about over the past few minutes. Dr. Stone, I'll have you go first. And I know you love talking about the power of the story, the power of storytelling in family medicine. One of you can share some closing thoughts on the power of storytelling in family medicine.
Well, I think as family docs, it's the foundation of what we do. We listen carefully. We always are looking at how we can better serve our patients, and we do that by understanding their stories.
And Varun, just some closing thoughts for you about maybe this project, or things maybe that you haven't shared at this point, just to kind of close up our discussion tonight.
Yeah, I guess like one of the one unique idea or thought that Dr. Stone kind of walked me through as well is it wasn't only that I was changing through ELI, it was also the mentors. And I think that's where I started to see I can help out my mentors. And I think with Dr. Boyd, she also would, there are times when it's hard. And I also have to be kind of eager and curious and be the one that was like, we can do this. Like, and I think that is a really cool idea is the arc of a family physician is you don't have to confine yourself into one box as I'm a researcher, I'm not a researcher. If you're curious and you're interested, then why not? If you're trying to help out your patients and this is an avenue, I think StoryCorps could be a cool thing to bring into the clinic and try out for your own patients and for your own well-being. I guess that's one of my thoughts I had.
Cool. We have some fabulous medical students here in Ohio, and we are more than happy to share them on this program. If you are a medical student, you have a story, you're in ELI, you want to be in ELI, please feel free to reach out to us. We would want to share your story. But if you missed any of this, it came in late, you can always watch this on demand on Facebook and also on YouTube. My name is Dr. Mike Sevilla, and we will see you next time on Bite Size Learning. So say goodbye, everybody. Bye.